Hello, everyone, and welcome to the Duff Phelps Kroll webinar series and our panel discussion, Mitigating Risks in the COVID-19 Vaccine Supply Chain, a current and hot topic these days. My name is Andreas Chrysostomou, and I'm a Managing Director and the Global Leader of Duff Phelps Kroll Healthcare and Life Science Industry Practice. Before we start, here are a few administrative instructions. Let me start with our disclaimer. Any positions presented in this session are those of the panelists and do not represent the official position of Duff Phelps LLC or its affiliates. This material is offered for educational purposes with the understanding that neither the authors nor Duff Phelps LLC or its affiliates are engaged in rendering legal, accounting, or any other professional service through presentation of this material. The information presented in this session has been obtained with the greatest of care from sources believed to be reliable, but is not guaranteed to be complete, accurate, or timely. The authors and Duff Phelps LLC or its affiliates expressly disclaim any liability, including incidental or consequential damages arising from the use of this material or any errors or omissions that may contain in it. The additional instructions that I would like to indicate that all attendees can submit questions through the question chat that you see on the right corner of your application, and our panelists will respond to them after their brief presentations. The presentations can be found in the handout section of the application, and we can definitely send directly to you via email at your requests. Today, I'm honored to be joined by three of my esteemed colleagues who are experts in their areas of specialization and with extensive experience addressing issues related to the supply chain. These are Stacy Scott, Managing Director in our Kroll's Cyber Risk Practice. In addition to founding and operating her own consultancy, Stacy has served in high-profile roles with leading cybersecurity consulting firms and a Big Four accounting firm, and of course, the largest not-for-profit healthcare system in Texas. Daniel Hartnett, Associate Managing Director with our Kroll's Compliance, Risk, and Diligence Practice. Daniel specializes in advising corporate clients in third-party risk management. He currently chairs our firm's supply chain risk management services. Last but not least, Nick Doyle, Managing Director and the head of our Kroll's EMEA Security Risk Management Practice. He advises clients on a range of security issues for enterprise risk management for multi-sector organizations, crisis management, business continuity and evacuation planning, and executive protection to surveillance support for investigations, technical security, countermeasures, and supports, of course, our cyber risk practice. Well, colleagues and attendees, I'm glad to announce that earlier today, the vaccination of COVID-19 has started in the United Kingdom. And also glad to say that the FDA announced earlier this morning that they are completing their review and they will be approving the Pfizer-BioNTech vaccine as well here in the United States, with the first vaccination starting as early as Monday next week. Finally, we see light at the end of the tunnel as the vaccination has started, and a number of additional COVID-19 vaccines either have filed for regulatory approval already, or they are completing their clinical trials and they're getting in line to seek approval in the various countries and regions that they're going to distribute them. What we need to recognize for all of us for our safety is the fact that there are still many, many months before we're going to be seeing the vaccine reaching the general public and getting to everybody. So be patient. It is really impressive, though, the speed by which the scientists, pharmaceutical companies, universities, research organizations, contract manufacturers, suppliers, transportation companies, hospital systems and physicians, not-for-profit healthcare organizations, governments, and even dry ice companies have worked together so quickly to get a COVID-19 out to the general public. it's amazing. It's less than 8 months when you look at it, and often the whole process may take several years. That being said, everything that is being done properly, and the vaccines are safe, something that we need to state. We all recognize that the more steps and the more participants and the longer the supply chain to get products from the manufacturer to the end user, the more risks that something will go wrong. And it's something that we need to recognize it. The number of risks are part of the normal course of business, and nevertheless, they need to be addressed. But there are also a lot of exogenous factors as well, and issues that they come up. These risks become more critical with the COVID-19 vaccine supply chain, given the speed and the magnitude of the effort to get the vaccine from discovery to the manufacturing to the practicing physician that will administer the vaccination. We recognize that speed often causes people and companies to cut corners and may not fully vet out suppliers or identify issues as part of the process. That may result into manufacturing delays, breakdowns, delivery issues. We need to kind of state that. But the most critical part is, of course, the fact that there are other bad exogenous issues. We have all read last week articles uncovering cyber attacks and phishing attempts from bad actors to penetrate the system and personally benefit as part of this. Bad actors have always targeted the healthcare and pharmaceutical industry and its supply chain from the beginning to the end, and we've been seeing it over and over again. But let me stop and let me ask my colleagues, the experts in the field, to provide and discuss the subject. Daniel, the floor is yours.
Thank you, Andreas, and welcome to all of our participants today. Thank you for taking the time out to talk about this, relatively important discoveries going on as we speak. Right, to Andreas's point, there have been a lot of movement. It's almost like a moving target in some ways. Every day there's new news breaking out, and we are definitely seeing a light at the end of the tunnel. It still is, unfortunately, a long tunnel to go, but we're definitely turning a corner here. So I'm going to take the time today, about 15 minutes, maybe a little bit less than that, to focus on sort of these macro risks, or meta risks, if you will, before then turning it over to my colleagues, Stacy and Nick, to talk about cyber and physical security risk more in detail. I just want to highlight to the audience, though, that you have a chat function, so if you have any questions at any time, feel free to drop them into there. We're monitoring it, and during our Q&A session at the end, we'll go into those. Let's begin actually first with a polling question, one of our first of 3 polling questions. So it's a simple polling question. There's no wrong answer here. It will not be any graded exams, but we're just trying to get an assessment. We have a diverse audience. What you see as the largest risk confronting the vaccine supply chain going forward. And you can see some options there. We're limited from a technical standpoint of only putting in 5 options. There are obviously more risk, and we'll talk about them. But go ahead and key in what you think is the biggest risk, and we'll see what the results are. We'll give it a few seconds. All right, it's a pretty simple 4-1 there. Let's see what comes out the other end here, if we can, please. Logistics challenges. Yeah, no actual surprise on that one, especially given all we've seen in the news in the past weeks and months, really talking about various challenges, some of which Andreas has already alluded to in his opening remarks. And we'll talk about some of these going forward here. So, okay, great. Let's go on to the first the main slide, please. Let me try and set the stage here before we actually dive into some of the challenges confronting the COVID-19 vaccine supply chain. It's really important that we remember that, global supply chains, as Andreas had already mentioned, they always have challenges and risks, right? It's the nature of a supply chain, regardless of how we break it out. They're complex, they're multi-tier, systems, oftentimes very opaque beyond the immediate partner that you're with, whether it be a distributor or producer or whoever is providing a service to your supply chain. It gets dark very quickly once you go deeper into a supply chain, either up and down a supply chain. They're often, crisscrossing multiple jurisdictions, and so that causes a lot of challenges for the operators and supply chain managers and the companies that are reliant upon these supply chains. At the same time, however, you also have almost an interaction effect for the risks, right? So where risks that occur somewhere else in the supply chain can then bubble through the system and either exacerbating other areas of risk or even causing new challenges that had not been, previously in existence before. So what this does then is it kind of exposes a company to risks and disruption, as we've seen over the past 12 months, right, because of the coronavirus epidemic, where disruptions, are becoming more frequently and they're having a larger impact upon the companies that rely upon them. Now, all that applies to all industries. Some industries are more exposed than others, obviously, and have more challenges. But what we are seeing is that the COVID-19 vaccine supply chain has its own unique challenges, right? And so I'm going to go through a few of these right here. One of the first ones is that there are multiple supply chains out there, right? We have to be really cognizant. Oftentimes when we read the media or we hear people talking about the COVID vaccine supply chain, it's almost like that's one entity, right, or just one supply chain, and that's not true, right? There's going to be, depending on how many vaccines are ultimately approved, you're going to have upwards of dozens of supply chains around the globe potentially. So each one of these will have their own challenges and problems across there. At the same time, there's idea of the speed of setup, what Andreas talked about. I really do want to reiterate the fact that, the men and women working as supply chain managers across the industry to set these supply chains up have really burnt the midnight hour over the past months, to get these supply chains set up. Historically, supply chains take years to set up, right? Maybe even a decade, depending on how complex it is from a global perspective. And that's a real big challenge at the end of the day. Getting over that, right? Because what it does is that means that you haven't really had a chance to actually work through any kinks in the system, from an operational perspective. And so that's one of the problems there, that may, introduce risk later on. Other areas, you may have a lot of new actors within a supply chain that have not been, tested before, that may not never operate in this type of supply chain, but because of the emergency situation we find ourselves in, have been asked to participate here. And they're all doing great work here. But again, the more new actors you have, the greater potential for risk you have later on down the road. So that's one area to watch there. Another one is the complex geopolitical environment these supply chains currently find themselves in. And here I'm particularly talking about the idea of vaccine nationalism, right, which is a kind of a buzzword being thrown around a few times, but it is a real issue. And we've actually seen an example in the Washington Post today that I'll talk about in a second. But the idea of vaccine nationalism is that where countries, use their leverage to, kind of procure a developed vaccine at the expense of other countries, so they can help their own population first, right? And so there's no lack of an equitable distribution of the vaccine across the globe. Now, the RAND Corporation, a DC-based think tank, came out with a great report on vaccine nationalism earlier this year, and it kind of laid out three major challenges of vaccine nationalism. The first of those is that because there's almost this rush to be the first on the scene with the vaccine, you want to sponsor your national champion, if you will. Companies may be pressured to take risks when it comes to testing and trial of the vaccine, right? Or they may be seen to be taking risks, even if that's not true, right, by the general population. And that could then lead to health concerns or knock-on effects such as vaccine hesitancy later on. Another challenge is that they could be hoarding of key inputs to the vaccine production phase in order to buy leverage so they can then acquire the produced vaccine later on, again, for their own population ahead of other countries. And finally, what we're calling these me first bilateral agreements between producers and nation states to acquire the vaccines that, again, are used to hedge out, certain amounts of the produced vaccine for their own populations at the expense of others, around the globe. So again, those are the problems there from vaccine nationalism. As I mentioned, the Washington Post has an article this morning that I commend you all to check out, where it talks about potential U.S. executive order coming out today that will look to see about restricting the export of the vaccine outside the U.S. until the U.S. population has it first. Now, I cannot speak to the legality of that executive order. I cannot speak to whether it be effective or not, or have any impact whatsoever. But it is something that I first heard about this morning, and so more to follow on that one. But it's a prime example of this notion of vaccine nationalism. Logistical bottlenecks, the number one polling answer, right? We know those are problems, right? COVID, the cold chain, for example, that Andreas talked about. There's challenges there in making sure that, if the vaccine requires these ultra cold storage and transportation handling procedures, how will that impact the distribution? Will it become a bottleneck or delay the spreading out to especially the more rural areas around the globe? Air cargo transportation is a major one, right? It's one that's kind of been talked about pretty good in more recent weeks. Is, from a global perspective, how do you distribute the vaccine, right? You're going to have to require upon, air transportation, and that goes a lot within the underbellies of passenger aircraft. Well, there's not a lot of travel going on right now because of the coronavirus pandemic, and so passenger aircrafts are not flying as frequently. Therefore, there's a restrained capacity there. Now, to give a shout out to the aircraft companies, or at least some of them, who have been converting unused passenger aircraft into cargo aircraft, that's helping a lot, but it's still not going to be enough potentially, or at very least it's not going to completely solve the problem. So the International Air Transporters Association, the IATA, came out with a statistic earlier this year saying that, if everyone is to receive, 7.8 billion people across the globe receive the vaccine, you need upwards of 8,000 Boeing 747 aircraft. But there's only just over 2,000 Boeing 747 in existence today, right? And if you throw an Airbus and all the other airplanes out there, it's still not going to reach that mark, at least not immediately. So again, it's going to lengthen the tunnel a little bit, especially if you consider the fact that not all aircraft are carrying, the coronavirus vaccine at all times. So the last point I want to make on my slide here is the idea of demand side challenges. And there's two real ones here. The first is just the extreme demand for the vaccine, right? We're seeing that already. People want this vaccine. They wanted it yesterday, right? At the same time, though, the distribution, the manufacturing, and the rollout is going to be in a phase limited fashion, right? We were talking before this presentation about how, I'm slated probably not to get anything until, summer time frame, for example. And that's fine, but it's going to take a while. That's my point, right? But when you have that demand, you have a disconnect among the general population. You create immediate haves and have-nots, right? Not just in the localized population, but on a global scale. And one area that's actually, kind of coming to the fore is in debates you're seeing here in the United States about prison populations. Should prisoners be in the first or second phase, vice non-incarcerated population, right? Maybe then in the fourth, fifth, or subsequent phases, right? So that's kind of causing a disconnect there and a little bit of angst among some of the population. But the second point, though, is something that's not always talked about in the media, is this unclear demand. Just because you create a vaccine, we shouldn't automatically assume that everyone's going to take it, right? Vaccine hesitancy is a real issue, particularly here, right? Because if there is a concern that maybe companies have rapidly, expedited their trials and testing phases, there may be this a belief among some of the population that, well, this vaccine is not safe, so I'm not going to take it. Now, I've seen statistics stating that upwards of 40% of the U.S. population may decline taking the vaccine. And it's even worse in other jurisdictions. 55%, I believe, was in Russia. That completely undermines a global vaccine campaign, if you think about it. So that's an issue to watch as well. Okay, next slide, please. Excellent. All right, so moving from those meta challenges or macro challenges down to more the ideas of the risk of disruptions, right? On the left-hand side of the slide here, you can see some of those that I've called out. There are more, obviously. We can never plan for all the risks that are out there in any situation or any complex system. But I do want to highlight a few of these issues here, or a few points about these issues. First, a disruption can potentially occur anywhere up and down a supply chain, right? It doesn't necessarily have to be just the manufacturing site. It doesn't have to be just for distributors. It can be anywhere, right? Take theft, particularly intellectual property theft, right? That can occur anywhere for the most part. Or a cybersecurity issue, right? That Stacey's going to talk about. That can also occur anywhere across, R&D, manufacturing, distribution, even in delivery to the end consumer, right? In theory. So there's a lot of problems along there, and we have to look at it from a holistic perspective, number one. Second, those interactive effects that I mentioned before, right? So let's take a case and example here where, maybe you have a little bit of corruption or fraud occurring within the supply chain somewhere, right? Which then leads to the idea of maybe theft of the product somewhere, right? Because, somebody bribed someone for a security guard, for example, got in there and got their hands on the actual vaccine, right? That could then lead to creation of black markets, counterfeit vaccines, which then causes maybe some health concerns or is a health scare within the population. And that then exacerbates vaccine hesitancy, right? And so you have these knock-on effects that go on there, and they're hard to clamp down on, right? You have to really nip them in the bud. A third point I make is that many of the risks are already occurring, right? These are not, hypothetical or, just theoretical discussions here. Look on the right-hand side of the slide here. You have a global alert from Interpol that went out earlier this week. We already know about hackers attacking the production and research and development phases of the supply chain, now distribution angles, and virus hesitancy. Well, unfortunately, it's there, right? So we know these risks are already there. That goal is, though, to tamp them down and prevent them from, expanding, really. And finally, I would argue that there's always the notion of black swan events, right? If we think back, it's almost, kind of a facetious question, but who was really considering a global pandemic 12 months ago that was going to shut down societies across the globe for months at a time in some cases? Nobody. Or if anybody was, we would have laughed them out of their room, right? But, well, here we are today. So we can never really eliminate all of these risks, right? They're always going to be there. All you can do is really protect yourself and inoculate yourself, to use the right term here, as best you can. Okay, so let's go to my final slide, please. So what can we do to help mitigate or minimize the impact of these risks? I think there's a lot that we can do. I would argue there's probably a lot that companies are doing, actually, right? Is whether everyone's doing it to the extent they should be doing it. That's really the only question that remains to be answered. I do want to start off, though, by noting you can never fully eliminate these risks, right? I mentioned black swan events previously there. But what you can do is you can mitigate the chance of them occurring, and you can minimize the impact that should they occur, right? Because again, black swan events, something you hadn't planned for, it's too complex of a system. You can never really think of all the possible challenges out there. But again, there are some steps there, some best practices that can be implemented across the board, really. First and foremost, I want to kind of highlight, I won't go through all of these, but I want to highlight some of the key ones I find. And really the biggest one is we really need to look at this as a complex system from the end-to-end supply chain. If we have learned nothing from the past 12 months of disruptions from various supply chains across the globe, is that a disruption can occur, or a risk can occur anywhere within a supply chain, and it can then work its way as a bubble through the system until it actually erupts into something, potentially cataclysmic. And so that's one of the really biggest things. Look at it as the end-to-end problem. You cannot just look at it as your just an immediate microcosm anymore. I think a second and related issue is the fact that in order to look at that across the end-to-end supply chain, you have to have visibility across the end-to-end supply chain. And that's not easy, nor is it cheap to do that, right? But we have to get out of this mindset that you can only look at your third parties, your immediate contracted partners, be they distributors, be they suppliers, or whoever they are. You have to broaden the aperture up as much as you can, particularly for key participants of the supply chain, right? I think another area to kind of focus on, and this particularly speaks to the vaccine hesitancy issue, is the idea of brand protection, right? And here I'm talking about the brand of being the actual vaccine, right? Where, companies, especially in the pharmaceutical world, have historically relied upon governments to fill this role, right? Governments coming out and champion the actual vaccine. And we're seeing that today, right? The CDC has recommended that United States senators get publicly vaccinated so they can then convince their constituents to actually also get the vaccine. And that's helpful, but it only goes so far at the end of the day. If you're already experiencing 40% hesitancy rate within the population, more needs to be done at the end of the day. Take it into a negative angle as well. What happens if there's an online smear campaign, right? Whereas there's all of a sudden there's, because of social media, that someone says, this vaccine produced by this company, there's health concerns with it, don't use it. Those things have a tendency to kind of catch fire among the population, given the nature of social media today. So you have to really be actively monitoring those and then proactively put in steps to tamp it down, should it, hopefully not, but should it occur. And the final point I'll make before I hand it over to Stacy is, this point about, using of simulations and exercises. So prior to coming to Kroll, I did almost 20 years in the U.S. military in various capacity, and I've come to become a firm believer in the value of, exercises and scenarios and tabletop exercises, and call them what you want, war games. They are a great force enabler at the end of the day for identifying risk in any type of system. And then working through them. They're relatively cost effective as well, and they can be run over and over again with just tweaking them. And so they're a great tool, an emerging best practice, I would argue, for supply chain risk management. I think they have a great role to play here, especially when you go back to one of my earlier points about the supply chains being relatively new and haven't really worked out the kinks of the problems in them yet. Well, then modeling and tabletop exercises will help you to do that. They're not as good as an actual thing, but they're much safer and a lot less, costly than, an actual disruption, of course. So with that, I'm going to stop. I'm going to transfer it over to my colleague Stacy Scott, who's going to talk more about the cyber risk. And I thank you for your time today.
Thanks, Dan. So real quickly, Dan mentioned new supply chains being set up quickly, flexibility required, public scrutiny, all these things. And to mitigate it, you need to increase visibility across the supply chain, which typically means communicate. And in these times, what do we use to communicate? Technology. So, you got to think about how do we use that technology? Where is it necessary? What are our third parties looking? What do they use for technology to monitor their systems throughout the supply chain? And really understand, if interruption or disruption were to come, how do we have leadership in these times of crisis, from getting the vaccine out and distribution and all the things that Dan mentioned? And really that comes down to making good decisions quickly and being flexible, like you said, Dan, but communicating. And that's where technology comes in. And so I want to walk through, what could happen or what could be happening that would potentially cause a situation where the vaccine distribution, development, or any part of the supply chain would be interrupted. And to do that, I want to walk through threat types. And describe cyber risk from that perspective. So let's start with espionage. We've seen reports of this. This is really for nation states really looking to get information on the latest vaccine formularies, on the distribution, on where it's going, so that they can get it first or discredit it or be, you said vaccine nationalism, Dan. It's a very good point. And so the quickest and easiest way to disrupt something, because we rely so much on technology, is to disrupt the technology, communicate, put out smear campaigns, or send phishing emails to try and get users of certain companies, the vaccine manufacturers, the dry ice manufacturers that Andreas mentioned, all of those folks, and create either a fear in them or get credentials from them by tricking them into clicking on something and verifying things. And the reason you would do that is to move throughout the system, the environment, the technology environment, and to get that information. Can I see who you're shipping to first? So I'll ship to the people you're not shipping to first, or I'll get it there faster, or I'll offer your vendors that you're using a higher rate so I can take them off of distributing what you've manufactured. All sorts of plots that you can think about, but it's espionage largely to get the information, the formulary, but also to disrupt the supply chain. So you got to think about those types of things. We've seen reports of this in India. They have phishing campaigns to purporting to be government agencies, claiming you'll get relief payments if you help distribute COVID vaccines or do new trials. And it's urging people to click and verify their information and submit personal information. They have nothing to do with the vaccine. They're just playing on people's fears and the hype around this, because it's a global pandemic, and they are getting users to click on things and share data that you wouldn't normally share, or sensitive data to use to sell later, all of those good things. So that moves me to my next point of criminals. This is really organized crime, and really their main goal is monetary gain typically. They typically use phishing emails again. It's easy, it's cheap for them. It's easy to send 1,000 emails with one click, right? So, I mentioned playing on fears. That's what they're doing. They want to get into the environment, release malware, get sensitive data that they can leak, or release malware, move throughout your environment and release ransomware, lock it up and ask for money. And they're doing this on the most essential or critical businesses. We've seen it in healthcare, a huge rise there. And I imagine we're going to start to see it on the vaccine supply chain, pharma companies, the companies that are helping logistics, the planes, the trucks. The disruption will come from, all sorts of areas potentially around not just your systems and your email, but the systems often called the Internet of Things. that are used to monitor manufacturing, or used to monitor a truck's whereabouts, the GPS systems that don't necessarily have sensitive data on them, but they're connected to the same network where you store that data. And they may be segmented and all sorts of stuff, but what they're trying to do is find vulnerabilities on those systems and get through your network to get where they want to get, either to the sensitive data that they're looking for, or just to encrypt and lock up your systems so you can't use them, or leak data for financial gain. So that's really the first two buckets there, kind of thinking through what's their motive and what types of attacks would they use, but also what data they're trying to get through. And I want to think about that when we move to the next bit about what you can do about it. Hacktivism, I think this is probably going to be an emerging threat as we've seen COVID and the pandemic and vaccines be politicized quite a bit. There's confusion over it. There's fear. There's hesitancy to take the vaccine, trust and all those good things. And hacktivism is really social cause hacking. If someone disagrees with a vaccine company, with a distributor, because they have charged too much money because they know you need it. There's reports of it on large news stations on Sunday and Mondays. They've interviewed people where there's companies that look to be in the game for financial gain only, right? And they're not keeping their fulfillment promises of the COVID vaccine or PPE. So I see the same thing coming here, and that upsets social cause groups, and they may hack to either disrupt or to embarrass or to discredit whoever they disagree with. So something to think about there. And honestly, the typical way that they do it, again, is phishing and remote access. And I'll talk a little bit more about those in detail, so that makes sense. And then the last one there, insider threat. I think this is likely to come from mistakes. Supply chains are being set up quickly. We're looking for more and more vendors or third parties to help us get what we need to get to people. And that means things are happening quickly. You may get emails, you may click on them, you may make mistakes. You may not do a complete due diligence, or you may miss something when you're doing these things. Yes, there are malicious insiders that may be trying to take advantage of some of these things and leak data to maybe a nation state or something like that, or for financial gain. But I think more often what we see is these are just mistakes. And so you got to think about, how do you educate your users and your employees and your third parties? I would consider your third parties as users, making sure you're limiting their access to what they can see as far as data, what they can see as far as send and sharing that data, and making sure you're monitoring that. And that should be a big part of your due diligence of the third parties, because we all use technology to get things done, not just communicate, but understand where things are in the process, logistics, and how we monitor those things. And so that's going to be really important when you think about insiders. I would consider your third parties in that bucket, because they're going to have access to some of your data, and because they need it. So you got to make sure you're looking at how they're accessing that and what they're limited to. So if we go to the next slide, I want to talk a little bit more about what you can do about it. And I really broke it down into 4 buckets here. And I think about healthcare, the industry, pharma, creating the vaccines, getting them distributed, all that good stuff. They're looking for the data around the vaccine. They're looking to disrupt you delivering it, and you being able to give it to healthcare workers, to frontline, the people that may get it first as well in hospitals, but also get it to those folks from the pharma and logistics perspective. The biggest things that we've seen in healthcare are phishing attacks, so email, but also remote access. There's a lot of workers, obviously, because of the pandemic, working from home, and remote desktop protocols, remote code execution, and our classic, they're called SQL injections. So just vulnerabilities on external facing access protocols is definitely being attacked, because they know it's being more widely used. These were also set up very quickly because everyone suddenly had to shift to home. And so think about those types of things. Make sure you ask your technical teams hey, what are we doing about remote access? Are we able to protect ourselves here? Are there any that aren't in use anymore as we move back into the office? Or if we're still at home and we're going back and forth, how are we doing this? And so think about through those types of things. The biggest thing you can do, because protections may take a long time to put in place and get fully rolled out, is monitor. Be able to detect and monitor. I think about my house. I have a front door, I have a lock on that door, I have an alarm. I even have a really scary 10-pound guard dog who barks at anybody, but will then, lick you to death if you come in and say hello to him. But anyway, I can detect if somebody's coming in my door. Could they still get in and break through and, come through the window? Absolutely. But because I'm detecting it, I will know how I'll be able to respond quicker. And I think that's where your technology teams should focus a lot of their efforts. And definitely put in the protections, but make sure you're able to detect if something doesn't look right. There's a flood of access requests. There's disruption. Things are getting encrypted. Or there's a lot of access failure attempts. A lot of those typical, attack behaviors will be able to be detected and respond as quickly as possible. So back to Dan's practice your scenarios, look at practicing these response scenarios. How do we do this? Let's get your technical teams, your legal teams, your operational teams, and your third parties, and the communications teams as well. They need to be there too, and walk through an incident really quickly. Could take an hour or two. Just sit down and say, if this were to happen, who do we call? What do we get involved? We may not know what decisions we're going to have to make and what data we're going to be able to have. So making sure you can practice those scenarios and get there. For the logistics companies, it's the same thing. Make sure you look at your technologies, but also the technologies monitoring the technologies, the Internet of Things, your operational technologies that are looking at where are my planes, how high is the cargo on there, what's the weight. The things that monitor those things aren't necessarily lucrative spots for attackers because they don't have sensitive data on them, but they are connected to the data, the networks that do have that data. So they're often used and exploited for those reasons. Even the video cameras, those are often exploited because we forget to patch those things. Make sure they're up to date, make sure you're monitoring that, ask your IT teams if those are on separate networks or in separate segments of the environment that does have sensitive data on it. When you move back to the office, just some things to think about there is, continuing the email phishing campaigns. We just see an increase in this. It's easy for the attackers. It's not expensive, and they can be sitting anywhere in the world and send these email attacks looking for, hey, confirm that you're in this office, or confirm this information, your personal information, so you can receive the vaccine and come back to work. You're going to get, some sort of special thing if you give me your information. It may not be real. Make sure you communicate with your users about some of these things. And that flows right into personal privacy. A lot of vaccinations, if you think about kids in schools, they require immunization records. Offices are now, and companies are now thinking about doing that for you to be able to come back to work. Have you been vaccinated? And a lot of that comes with the concern and risk of leaking too much personal health information. So look at your compliance officers, your company compliance officers, kind of research a little bit about what information we absolutely need to collect and what do we need to collect. The proof of, immunization maybe, but I don't need to collect your date of birth, your health information, all that other good stuff, or the actual record that may have too much for us and cause personal privacy issues for your employees. And the same goes for those that are in healthcare that are probably receiving it first. Just think through all of those things and make sure you've got your users educated and you've got plans and backup plans for your backup plans, right, Dan? So with that, I want to flip it over to Nick, and this for the sake of time, to discuss a little bit about physical security for us.
Brilliant. Thanks, Dan. Thanks, Stacey. And obviously, thank you, Andreas, for introducing us all. So we've seen some fantastic news in the last few weeks where there are a number of vaccines about to become available across the world. And as you've heard, the vaccines are being rolled out to the most vulnerable in the UK as from today, across 70 hospitals. But the distribution of vaccines will be a monumental challenge, which will take months, if not years, to complete. So supply chain security will need to be effective to ensure nothing happens to any of the vaccines during this process. This is not a time to make mistakes. Reputations of all those involved in the supply chain will be at stake. The vaccine relies upon integrity from design to manufacturing to distribution and to ultimate use. Some, if not many of these, are medical factors, but all are underpinned by the overall integrity of the process and trust. In the physical domain, installation of the manufacturing and distribution process is intimately linked to what we think of as security. However, this isn't all about guards at warehouses. It's essentially about identifying points of weakness and appropriately risk managing them. Like other low likelihood but high impact risks, one major breach could have consequences far beyond the compromise of a single shipment, as it could affect the wider acceptance and trust issues. It also reflects on the overall competence of the process. So securing the supply chain takes a full understanding of the chain. A failure, a theft, an adulteration, a penetration may arise due to a security breach, and someone or some organisation will be liable for the loss resulting and the reputational impacts, and there will be reputational impacts. So just like continuity of evidence in investigations, speaking as a former police officer, there will need to be continuity of security across the full vaccine supply chain. So a complete security plan should reflect all the vulnerabilities and include any security functions provided by third-party providers who may be located globally. You need to clearly identify the threats, the potential impact, and your preferred outcome. As Stacey and Dan have already said, in terms of threats to the supply chain, they can come from many directions, including organised criminals who steal to order, who may have already been involved in the movement of narcotics or other high-value goods. But now their focus will be potentially on vaccines. And we've seen news reporting on this over the past week or so. Then also, as Stacey quite alluded to, insider threats from within the supply chain, such as people who've been contracted or hired to handle, manage, transport, and to protect the vaccines whilst moving through a section of the supply chain. It's important to include a number of measures, policy and protocols, and well-trained personnel to monitor the supply chain security program. So if one of those areas is circumvented, the potential infiltration or loss can be captured by another aspect of your program. As I said, it's been reported in the last few days about criminal gangs targeting vaccines, but they're also, as Stacey's highlighted, conduct online scams for people to purchase vaccines in an attempt to make significant money. It's likely that any stolen vaccines will try to be circulated on the grey and black markets to people and even countries in the developing world who are looking to get early access to the vaccines at a potentially reduced cost. And this is important, parts of the world, such as countries with limited medical and logistical infrastructures, will need to be included in the distribution of vaccines as early as possible. And I hope this happens in the coming weeks, because they cannot, places in sub-Saharan Africa cannot be left behind when we're distributing these vaccines. Every life is important, every vulnerable person is important. So efforts need to be made collectively, especially amongst the more developed countries, to try and support those countries that are in need. But it's also important to know that any tampering or failure in continuity of supply, and this is important when we are distributing the vaccines to countries that haven't got developed security, logistical and medical infrastructures, that to ensure that the vaccines are secure, they are delivered properly, because if the vaccines could be invalidated if there is a problem within the supply chain, if we're going to, in many diverse locations. So as Stacey has said as well, the insider threat is an area of focus within any supply chain security program, and it's definitely got to be an issue within the vaccine supply chain security program. These could come from rogue or careless employees, as we've said, contractors or persons involved in the organisation that supports the supply chain. So tight processes are designed to ensure accountability of persons and traceability of the vaccine, but they need to be part of that risk-based security plan. So if you go on to the next slide, in terms of the physical security measures of R&D facilities, manufacturing sites and distribution centres, as part of the complete security programme, security will need to be consistent across all these sites and more, as distribution will include hospitals, as it does here in the UK at the moment, and doctor surgeries inevitably in the next few months will probably also be part of the vaccine distribution network. And many of these do not have the adequate security measures. So a re-evaluation of security needs will need to be conducted for these facilities that may not necessarily understand the risk because they've never had to deal with these potential risks before. And that's the difference. So what we're talking about here are layers of security. And you know, we always say within the security sector, ideally you should have at least 3 layers of security. And the closer you would need to get to in this circumstances, the vaccines, the harder it would be to get authorized access and steal the vaccines. So any security measures will need to be proportionate, obviously, but effective. And these would include access rights, especially around access control systems, CCTV monitoring, and obviously remote monitoring of where vaccines are stored, but also of vehicles who are transporting these vaccines around. So vaccine supply chain programs should be comprehensively reviewed or developed, if not in place, to ensure that organisations reduce their vulnerability to these type of potential disruptions. And for supply chain integrity to be preserved, each link and transfer point needs to be examined, understood and protected. And time pressures are obviously, and capacity building are obviously going to be an issue in terms of the vaccine distribution. So security has to be involved in each particular part of this planning process. And as Dan has quite, and I think Stacey mentioned, organisations need to know and understand if third parties are dependent on either their own partners or other third parties. And we need to understand who is actually, or determining who is actually providing the service within the supply chain in terms of either the logistics or even the security. The security risks, I think Dan and Stacey again talked about these, from criminals and even opportunists, but as I say, people within the supply chain could also, the insider threat could also be an issue. So I think what we've also talked about here is the complete security plan should include the protection of intellectual property. As a goal of business, and ultimately these pharmaceutical companies are businesses, it should be to protect their own IP and also the IP of the people it deals with. So in terms of logistics supporters or security providers, they will also need to protect the relevant IP that they may get access to in terms of delivering these types of vaccines to the end users. So understanding the supply chain process, analysing the process and allocating resources in terms of security to validate the process are key to an effective supply chain security risk management programme. It's crucial that the supply chain be secure and that people have comprehensive confidence that risks are being identified, assessed, and that detailed mitigation plans have been put in place. So I'm essentially, going to finish my piece there just to allow us time where we can have some questions from the people on the webinar.
Thank you, Dan. Thank you, Nick and Stacey. I really appreciate at least going through the details on some of the risks that the COVID-19 vaccine supply chain may face, or we are facing right now because the process already started. Some of the questions that they already kind of been funneled to me. I'll start with Nick, since he talked about even the physical security and issues related to that. Last week, I kind of watched an interview regarding the Pfizer-BioNTech vaccine distribution and how the companies have developed their own process, given the fact that the vaccine itself needs to be kept at a significant low temperatures. They talk about monitors inside the boxes that they can track at any time. They will be able to say who will eventually get the vaccine based on what they were saying. Now, that being said, we recognize that there are other issues. And maybe from your standpoint, Nick, what are if you were to name the top 3 security threats that the vaccine supply chain is facing right now, what would be that?
In terms of security threats, sorry about that, I need to unmute myself there. In terms of the security threats, obviously we've identified the areas such as organised crime, opportunists and insider threats. I would suggest those are the potential risks, physical security risks to the distribution, well, the manufacture, distribution and storage of the vaccines themselves. So those 3, I think, are key.
Okay, great, thank you. Maybe a question for you, Stacy. Are there any specific examples of cyber security attacks to date? Again, you mentioned maybe a few earlier, but anything in particular that comes to mind?
Yeah, there's a lot of reports of espionage for the pharmaceutical companies creating the vaccine, but there's a lot of others around hackers attacking I think Dan put a little blurb up there around the cold chain, keeping it cold, all those good things. But the biggest thing we've seen is remote access to systems that are managing these things are being attacked because they're more widely used, but also phishing emails to get users to click on things, playing on people's fears. Those are the biggest things that we're seeing. And not just remote access protocols, not just VPNs or RDPs, which is remote desktop protocols, but also any external facing systems. Those are being scanned for vulnerabilities and seeing if they can attack those vulnerabilities to either take those sites down or those systems down and or get into other parts of the network to get where they want to go, whether it's to lock it up and ask for money, or to get to the data they'd like to see, which is, a formulary or transportation or vendor pricing and all that good stuff. So that's really what we've seen, and there are numerous examples and reports of it across the globe, truly, that we're seeing quite a bit of.
Okay, great. Thank you, Stacy. Maybe Dan, a question for you. We kind of recognize that the vaccine supply chain has existed, again, flu vaccines or all the other polio vaccines that they've been distributed. Nevertheless, we kind of recognize that there are some unique aspects with the new vaccines that we are seeing from basically our manufacturing, our pharmaceutical companies. That being said, and given the size of the COVID-19 vaccine supply and the magnitude, and the fact that now you need to kind of even get out of those traditional, the traditional supply chain, is it even feasible to economically conduct all the comprehensive due diligence for the various participants and make sure that you're going to have new participants coming into the supply chain? You're changing the process. It's basically the timing that you need to kind of deliver all these things. Do you really find it feasible to economically go through that due diligence and make sure that you tick and tie every supplier and you check every background in the whole process?
Yeah, so that's actually a really great question, and it's a challenge. I mean, it's a challenge in any supply chain. It's massive. In order, where is the return on investment? Where does it come to be cost prohibitive at the end of the day? Here it's a little bit different, unique, because I think that we have to be a little more forward-leaning from a comprehensive due diligence perspective. But there are ways to economize the costs, right? And you really need to steal from due diligence best practices first and foremost, right? You really need to understand your third party, your vendor ecosystem, right? Figure out who's even out there, number one, right? And then you kind of come up with a kind of a risk matrix. So you prioritize which ones might be the riskiest ones, be they from, maybe they're exposed from a cyber perspective, or maybe they have, are in jurisdictions that are, more at risk for issues like theft or tampering, right? We've seen before in other jurisdictions and different types of products, right? So those are the ones you can help you to make decisions where companies can then prioritize their limited resources. And let's be honest, we all work in a world of limited resources, right? So you can't equally screen, each third party, fourth party, whoever it is across the board. And another thing that we've learned is that, your third parties may not be the most important ones at the end of the day, or the most riskiest ones. They may be somewhere down in your fourth or fifth tier somewhere. But you need, again, without that understanding of the ecosystem, you can't do that. You can't prioritize your resources. I think also you can kind of come up with a way to rely upon technology for a lot of things, not everything, but you can rely upon technology to the points that Nick and Stacy both made. But even from a regulatory screening perspective, there are a lot of, lower cost screening things that at least give you a plausible comfort that, yes, this actor is not an adverse actor, or their checks are in place and we can roll with them. So there are a lot of different steps to do it. At the end of the day, it still will be expensive, though. At the end of the day, it's not going to be free or cheap at that point. But there are steps that can be done to, economize the costs and prioritize the riskiest areas, and they should be done actually.
So do you see then the risk of disruption go away over time, or is it something that pharmaceutical companies or everybody, every participant in that supply chain will keep basically monitoring over time?
Yeah, I mean, I think it's, to give a flippant answer, it's a little bit of both, right? So in some ways you will have the change in the risk. I would say the early stages are probably the riskiest in some ways. That's when the demand is far outpaces the supply. But risk of a supply chain will always be there. They may just change into and morph into different types of risk over time. So maybe theft goes down a little bit and a different cyber risk comes up there, for example, particularly when you have, data privacy issues and personally identifiable information involved in there. So risk is always going to be there, unfortunately. The nature of it may change, and maybe we'll get better at dealing with it over time as well. But then a black swan event. Right, and so it's always going to be there. Again, you can never fully eliminate risk, regardless of the type of supply chain or product we're talking about.
Okay, maybe another question that I came through: which points of the supply chain are most vulnerable? Warehouses, the distribution centers. Where do the criminals try to basically penetrate more? So again, maybe it's open to all of you. I don't know, Stacy, if you think that you can maybe start from there, and then Nick can give his.
I would say everywhere could be vulnerable, and that everywhere needs to be assessed to identify where they're vulnerable, not just from a physical perspective, but from a cyber perspective, and also from a due diligence perspective. So collectively, unless you're doing all the supply chain, then you're not managing all the vulnerabilities, and you're not performing risk management.
Exactly. I agree with you, Nick. And I think if you look at technology being used from a cyber perspective, again, it's those systems used to monitor your systems. There are the Internet of Things or different, video cameras, different things monitoring physical security, but also your manufacturing process. Do you know how much went through? Those are a lot of times connected to the same network. So going to check through those facilities and throughout the different pieces of your supply chain, the warehouses, checking your supply, both from a physical and cyber perspective, I think I would say it's equal at this point. And until we see maybe some events that are reported where they might be hitting them, I think those are all easy to access because of cyber and technology.
Thank you both. We are up on time in terms of basically our presentation. There are a few additional questions that they came through that we probably going to be able to provide to you responses either via email or reach out to you. Apologies that we don't have time to go through all these questions. Really thank you for participating in our discussion, and thank you to our panelists, Dan, Nick, and Stacy. Really appreciate your input. Thank you all.
Thank you.
Thank you.